Hello, everybody. Thank you for being here. So, um, few stuff to start with. Please send me a thumb up or okay on the chat into the chat if you can hear me properly. So I can't see you. So this will be, let's say, for the interaction, we need to use the chat. Um, I don't know how many of you will be attending this webinar, but now we are getting, let's say, on time. Uh, it's 6 after 5. So the idea today is to make a general webinar about Wintecare stuff, about Wintecare devices. I'm pretty sure the most of you are used to the use of the device in your center. We will try to see some protocols as well about simple application for clinical cases. And then, going through some of the theoretical principle, always useful in order to understand how to manage the device in terms of current flow, in terms of reactions that you can stimulate with the unit during the treatment. In case you have question, as always, please use the chat box. So you can text, you can send me a text about what you have in mind. I'll do my best to give you an answer during this session. If not possible during this session, then there will be a follow-up through Andras in order to let you have the answer to your question. So, trying to go straight to the topic, I am going to use the presentation in order to let's say have a structured process during the presentation. And okay, should be here. 1 second. Okay, so briefly, and trying to know each other a little bit better. I don't know how many of you have already attended one of our courses. Anyway, Wintecare, something about Wintecare. Let's know each other a little bit more. Here you can see a couple of magazines. We issue one edition more or less per year. In here you can find a lot of information about clinical cases, new centers opening with our technologies, clinical cases, research from the university, working sport, anything that can help you in understanding a little bit better the world of Wintecare, but at the same time, a lot of interesting information that you can use for a practical, I would say, application in your center. What does Wintecare means? Where it comes from? Winning technologies for healthcare. So from one end, we wanted to have the word tecar within our name. We are a specialist of this technology, so we're not a generalist. We don't have many products in our portfolio, but at the same time, we wanted to have a more open, I would say, principle. So that's why the word technologies. In fact, we have more than one technology in our portfolio, and we will see why and which one. Different activities within the company, different areas where we create value. From one end, production. Okay, so we are a manufacturer, so the final assembly of the product is made here in Switzerland. That's where we give the serial number, and we let's say keep under control the traceability of the product so that we know where our products are spread out in within Europe. Then there's a regulatory office taking care of the certification. We have several certifications, the CE mark, the FDA, the KFDA. We are getting the certification for Japan. We have the Russian certification. And then, of course, we are certified 13485 as a medical device manufacturer. So from product point of view and from a process point of view. Then regulatory connected to research. Why? Because nowadays, if you want to certify a product as medical, you have to come up with the evidence that your product is actually effective in the fields of application that you are claiming in your documents. So for each of the fields of application, you have to have at least one published paper about that topic. My role within the company is, among others, the clinical evaluation of our devices. So my role is to go on PubMed search engine, trying to identify new studies about the use of our products. Then research means also primary research. So we have a relationship with universities. We give the idea of a specific study, and then they run the paperwork collecting data so that we can hopefully get a publication about that specific topic. The cooperation is with the several universities. One is with the Università Internazionale de Catalunya, that since, let's say, since the beginning gave us a lot of value. This content then is brought into the education. Okay, so we have several events, both online and offline, both for people that want to understand a little bit more about the product before buying it. And then we have actual courses that address more in practice how to use the device for the different fields of application. We had one recently in Novigrad in Croatia with Fizian. It was a great success with 50 therapists coming from all over, with 3 days of intense knowledge sharing and a lot of practice about, once again, the different fields of application, different clinical cases. Technology. We have an innovation department. Normally, an idea starts with some playing around with the tools we want to develop. We create a beta version of the product, so something that is not final, but is a sample. We test it. If the results meet the expectation, then we refer to the university in order to verify that from a scientific point of view. If everything is okay, also in that moment, it goes back to our engineering department. We create the product, we create the document, regulatory for the certification, and then finally the manufacturing process. Okay, I see Lara asking for some protocols. Acute piriformis syndrome, I'm not sure is part of the program today, but I will do my best to see if we have something similar, or at least if we can address it, just talking, understanding how we could manage it with it. Of course, this is related to non-specific low back pain, or let's say to the causes of low back pain. So it's something we can definitely address along the way. Then working sports, it's another important aspect of our daily work. We have a group of about 40-50 people traveling around in order to work with the athletes we support, different brands. So for instance, this year we attended the Olympics Games, where we have a dozen of specialists going there working on a daily basis. A way to collect data, a way to make some team building and evolve the different treatment programs. So the laboratory in Barcelona, different areas from different, let's say the in vitro department with different cell lines, how the electromagnetic fields affect the cell behavior, a cadaver lab, so that we can understand how the electromagnetic fields works within the tissues, how deep we can be with the effects, both for thermal and non-thermal condition. Then we have clinical department working, for instance, with elders, working with the tendinopathies, post-surgery, in order to have an idea on what would be the best protocol possible in order to address that specific situation. And then there's a performance department, gas measurements, lactate analysis, performance measurement, everything related to sport performance. So how the device can be used in order to support an healthy patient, an athlete, in order to do something better for both T plus and D plus. And there's a huge potential of application in these fields. As you can see, there's actually a laboratory, multisystemic rehabilitation laboratory, patrocinado por Wintecare. So these guys works for our paperwork on a daily basis, a huge source of value for our clients. This cooperation got to about 9 publications so far on impact factor reviews. These are studies made with T plus. Probably the most impactful is the one on scientific reports of the group of Nature. That is the same let's say journal where companies like Pfizer make the publication. Okay, so it's pretty an important journal. The purpose of these studies was to understand how deep we can be with the electromagnetic field. The findings are showing that we can reach any type of tissue. Keep in mind that the effectiveness of any drugs, any pharmaceutical product, any medical device is the capacity to reach the tissue target. Okay, so if you're not able to get there, there's no way you're going to have an effect. So here we can get down to a ACL ligament, so anterior cruciate ligament, the insertion of an infraspinatus, the sacrotuberoso ligament, any depth within the body can be reached with these electromagnetic field. Production, we touched this point already. Regulation, we touched this point already. Here we see some certificates. Once again, the FDA approval, the MDR approval, so the new regulation for medical devices, more severe about the clinical evaluation. So that's basically my job. We were able to get the certification for the T Advanced, and that's the only tecar device for medical application certified within the MDA regulation. The KFDA for Korea, the Russian certification, and then the process certification. Working sports, we are not commercial sponsors, so we work along with the athletes during the season. We collect data. We see a lot of clinical cases. This is a huge opportunity for you to learn and acquire all the knowledge you need to be a specialist with our products. So you have the chance to shadow one of the senior during seeing a huge amount of treatments on a daily basis. Okay, it's like having a course of 2 years packed in 3 days, especially during the Diamond League events. So something I'd encourage you to speak about with Andras. So if you have the ambition to participate to one of these events, there's a chance you can do that. Ask to Andras and let's see what happens. Of course, working in sports means getting in touch also with huge champions like the world record holder for pole vault, Mondo Duplantis, like the Olympics champion Tamberi, guys from the 400 meters. So a lot of interesting meetings during these events. About the education, I would say that the peak of our education is in during the World Wintecare Summit. The last year was held in Tenerife. We gathered about 100 people over there. So taking together therapists, doctors, professors from the university, sharing the results of the different studies, showing clinical cases, sharing knowledge, and trying to contribute to the evolution of this amazing type of therapy. A lot of work also on the track in order to understand the difference between being a studio therapist, so someone working in a room, and someone working on the track. So less time with different objectives, working side by side with athletes. Technologies, as I was saying, we are a specialist, but we also have other technologies within our portfolio. Today, we are focusing on the T plus and T plus protocols, but then we have also another device for capacitive resistive energy transfer that will be launched in April 2024. That is the T advanced. So it's like the big sister of the T plus. So still a capacitive resistive energy transfer, adding to power also intelligence. It gives you the possibility to manage in a better way the current flow during the treatment. So the communication between the handpiece and the control unit based on the impedance between the tissues, so between the electrode and the plate, and knowing which electrode you are using and the temperature of the tissue, it adjusts the level of current that you need. So that when you have a big amount of tissue between the electrodes, it releases more power so that you can get to the result in a quicker way. Or when you are close to the plate, so less tissue and you don't need the power, it will control it so that it is not harmful for the patient. So no superficial overheating. Then there's a third technology, V+. This is a focal vibration. It is used in order to deal with the neuromuscular system. So anytime we need to train the central nervous system to have a better understanding on what is going on within the local tissues. So T plus, T advanced to heal the tissue, to speed up the rehabilitation process, V plus to make it immediately available to the central nervous system. Better muscle control, better coordination, improve the gait stability, improve strength and explosiveness. That's why it's a great tool when you want to work on performance. T plus, okay. So before getting to the protocols, what is about T plus? So what we are talking about, you are familiar with the word tecar, that is an Italianization of an English acronym. Actually, tecar is the acronym of an Italian wording, so trasferimento energetico capacitivo resistivo. But originally, and more consistent, is capacitive resistive energy transfer, CRET, okay? What does it mean? We are transferring energy that can be measured, joules, and we do that in two modalities, capacitive and resistive. Why two modalities? Because these allow us to control where this energy is accumulated. And based on where it is accumulated, then we can better control the physiological responses, so where they are going to happen, so that we can control the clinical result. Energy transfer. Why stressing this point? Physical therapy in general is about energy transfer, okay? So if you're using an ultrasound, if you're using your hands, if you're using shockwave, if you're using a laser, if you're using microwave, whatever, you are using energy to make something happen. But there's something important to keep in mind. The amount of energy per the amount of tissue treated is related to what will happen within the tissues, okay? So we have to keep this in mind. And another point is the more energy we are able to transfer in less time, the quickest we will be in our treatment. Okay, so it's not that just one joule will be able to do whatever we want within the tissue. So we need a certain amount of joules in order to make things happen. That's why your device is so powerful. That's why a T plus allow you to transfer up to 18,000 joules per minute. That is a huge amount of energy compared to others. Take into consideration that a treatment ultrasound normally transfer a maximum of 3 watts. Okay, here we are talking about 300 watts. So the difference is 1 to 100, okay, the proportion. The energy transfer take place through the application to the body of an alternating current that varies in polarity at a constant frequency of 448 megahertz. The change of mineral concentration within selected body areas trigger complex cellular responses based on membrane potential. In turn, it results in physical effects as perfusion, vasodilation, heat generation, temperature variation, and drainage. If needed, temperature increase can be quickly achieved through a Joule effect induced by a market power increase. So, things to remind here. We have 5 reactions. Okay, one is not mentioned here, but is mentioned in the following slide. Blood perfusion increase, vasodilation, drainage support, thermal increase, and cell proliferation. These are the 5 arrows, the 5 weapons, the 5 tools that you have in your hands in order to have a better clinical result. You will control where to stimulate this reaction based on the amount of energy that we are transferring on that specific portion of tissue. How we do that? Applying an electromagnetic field at 0.448 megahertz. So it's a very specific type of electromagnetic field. The thing that is so high that is not perceived by the peripheral nervous system grants us the effect without any weird electricity feeling during the treatment. Even though we're talking about electricity, the patient doesn't feel electricity during the treatment unless you're using an old tecar unit that is giving some shocks during the treatment, but it's not this case. Why 448 megahertz, 448 kilohertz and not other frequencies? Okay, if we analyze the folder with all the studies published so far on capacitive resistive energy transfer, and we make an analysis of them, so we need to download them, read them, check which device is used within that specific study, checking the frequency of the device, we will see that 85% of the studies published on impact factor reviews uses devices with the 0.448 megahertz field. What does it mean? It means that it's the most studied frequency, the one that grants you the effects that I was mentioning. Okay, so it doesn't necessarily mean that the other's frequency doesn't work, but it means that the others doesn't have an evidence. So we don't know exactly what they do. We still need to work on some studies in order to understand what is the discriminant between the different frequencies. So if you want to stick to science, use a 448 kilohertz device in order to do your tecar treatments. Reactions. We were mentioning temperature, blood perfusion, and so on. Here, here we see a baseline, so the upper portion of the screen, and then the post-treatment. The evidence is we can stimulate a macroscopic reaction within the vascular responses, okay? So from a baseline with a narrow vessel with blood perfusion, with a more vasodilated vessels, the main vessels are increasing their caliber, and then the activation of minor vessels, so meaning more blood is getting there. This turns into a perfusion of muscle tissues going on the surface. Okay, so what we see here in laser speckle is the reflection of light of capillaries that are filled up with blood. Okay, if we are pushing with the power, we are also able to increase the temperature strongly. Blood perfusion is related to an increase of the oxygen saturation, especially when we work in resistive. So, if our tissue is in acidosis due to chronic inflammation, or we need to perform a muscle recovery, or there's compartment syndrome, lack of oxygen in the tissue, this is the right tool to use. Use a resistive in order to stimulate deep blood perfusion. Once again, temperature, few seconds to reach 40 degrees. Really few seconds with a T+. And this is not a temperature affecting just the surface. It's a temperature that is going in depth within the different layer of tissues. On this topic, just a quick note about temperature. Take into consideration a bottle of water and a pool, okay? The two can be at the same temperature, 12 degrees, okay? Same exact temperature. What if I want to increase the temperature by 1 degree of the bottle? We need just 500 calories. That means more or less 1000 joules, more or less. Okay, so with a T plus is something that can be reached really in few seconds. But what about the pool? Within the pool, we have much more thermal capacity. So we need much more calories to change even just 1 degree of temperature. Why I'm telling you this? We need to understand the difference between temperature and calories and heat, because otherwise we risk to choose the wrong device. So when we have a unit that is overheating a lot the surface, normally this is an indication that our unit is wasting energy on the surface. In fact, most of the time when we turn off this type of unit, the temperature disappears pretty quickly, meaning that we did a lot of temperature, but with not much energy. On the contrary, when we have a unit that is transferring the energy inside, the temperature rises evenly on the different layers of tissue. So not just on the surface, but also in depth. This is the right unit that you need. Which is the most important variable you need to take into account when doing a tecar treatment? It's not just the energy, it's not just the power, but is the current flow, okay? The current flow, as we can see from one of the Joule's law, has a quadratic, a squared impact on the energy transfer. So when we need to reduce the time because we want to earn more money, or we are pushed to result due to the fact that we are working in sport or whatever related to time, we need to increase our current flow in order to save it. And this will have an impact in terms of energy transfer. This tells us also that if we compare a device that gets up to 2 ampere, like T plus, with a unit that has just 0.5 ampere, like many other units within the market, the difference in terms of energy transfer is huge. It's not just 4 times. So it's not just 2 divided 0.5. It's actually 16 times. 2 times 2 equal to 4. 0.5 times 0.5 is 0.25. So 4 divided 0.25 is 16. So a difference in terms of time impact between a device of 2 ampere and a device of 0.5 ampere is 16 times, okay? And this is value for money, okay? So time is value. Then we talked about the possibility to support tissue regeneration. Here is a study published in 2016 showing that 0.448 megahertz or 448 kilohertz promotes proliferation of human mesenchymal stem cells. So from one end, we support the transport system of our body, okay, our circulation. So bringing their oxygen, bringing their nutrition, but at the same time, we are able to increase the amount of material, raw material available and workers available on site. Okay, so this is the amazing part of a tecar treatment, especially when we are dealing with tissue regeneration. Capacitive and resistive. So what is the difference? I'm sure you're familiar with this, but let's say that in resistive, between the plate and the electrode, there's an electromagnetic transfer of electrical charges. Everything in between is involved. So if I put the plate under the abdomen and the electrode under the plantar fascia, we actually we are affecting the whole leg, okay, everything in between. The ankle, the calf, the soleus, the knee, the hamstring, the gluteus, everything. In case we are using a capacitive, this is different because in capacitive, we are not transferring, we are generating a current flow close to the electrode. Deep, but still close to the electrode. So, with the example that I was mentioning, plate under the abdomen, electrode under the plantar fascia, almost all the effect will be on the plantar fascia itself. So we can control where to accumulate our energy and so where our reaction will happen the most. This turns into evidence also in thermography. Left, we have resistive. Right, we have capacitive. Sorry. Okay. So what will happen is that in resistive, the accumulation of energy will be where we have the higher electrical resistance, okay? In this case, on the wrist, okay, joints are normally resistive structures, especially on our limbs. So the heat effect will be on the wrist itself, where we can increase the temperature by 7 degrees in a few seconds. With a capacitive, actually, the effect will be focused where I laid down my electrode. Okay, so from one end, we could speak about a focal effect. On the other hand, a more spread effect. What happened from a vascular point of view? Temperature and vascular responses are pretty connected, okay? So in resistive, what we can expect is once again a thermal increase on hard structure that turns into a blood flow response that is higher in temperature compared to the rest of the tissue. This is visible here from the wrist. There will be a line, a whitish line that is going upward, okay? Give me a few seconds. Okay, you see this line is a vein filled up with blood that is higher in temperature. To take into consideration, why? Because this means that we can work more on range of motion, on the viscoelasticity of the tissue, on the metabolic stimuli of the tissue. But what if we wanted to have a drainage with no thermal increase on the inflamed spot? Let's assume that we have an inflammation at the wrist level due to a distortion, okay? In this case, capacitive, it's better. Why? Because the vascular response is colder. It's not going to heat up our inflamed tissue, but is going actually to drop the temperature and take away the catabolites that contributes to the inflammatory process. See the vascular response, how prominent it is, okay? Something deep, something macroscopic. It is not just microcirculation, it's actually blood perfusion. Another advantage of the T plus is that you have both hyperthermal electrodes on the left, So able to increase the temperature as much as possible in the shortest period of time. Or you can use a hypothermal electrode, especially when you need to drop the temperature because you are treating an inflamed tissue. Okay, so when you want to drain an inflamed tissue, the hypothermal electrode will be your guy. Do you recall we were speaking about the fact that a bad tecar is accumulating all the energy on the surface and not that much on in depth? This is the example, okay? This is not a T plus, it's another device. What we can see is as soon as we start transferring the energy, the tissue remain at the same temperature of the baseline, more or less. But what we can notice is a change, a sharp change in temperature on the edge of the electrode. What does this mean? It means that we are working a lot on the surface. We are doing a lot of temperature increase on the surface, and we are not transferring energy inside. It means that we are wasting time. It means that we are using a thicker device as it was an ultrasound for treatment. Look at that. It reaches up to 50 degrees on the surface. It means that if you try to touch the electrode, you won't be able to do that unless you want to get burned. And the patient will keep complaining about the fact that the electrode is super hot. We are overheating the surface, but we are not going inside. And once we get to the end of the treatment, even though it seems like the tissue has changed in temperature, as soon as we release the electrode, the fading effect is almost immediate. In few seconds, this will get back to its original temperature. Why deep temperature is so important? Okay, because sometimes we want to affect the viscoelasticity of the tissue. Look at that. Here we have a soleus crossing a gastrocnemius, and we can see with high definition ultrasonography the space between the different layers of the fascia. Okay, so this whitish part over here, white means more dense, dark means more smooth, more liquid. Inside, we see a grayish aspect. What does this mean? It is not so fluid, okay? So it could be sticky or jelly. So the movement will cost more effort. After the application of 3 minutes, 0.5 ampere capacitive hyperthermic with no mechanical action, we can see that the dark and white contrast is much clear, okay? So here we have a black area, meaning that we have a fluid inside, meaning that there's a better gliding between it. Even more evident on the thoracolumbar fascia. This is on the left, the typical example of I'm moving my neck and somehow I feel tension on my butt, okay? Why? Because there's a fascia connecting all the muscles, the extensors, the multifidus, and whatever, that is pulling from the neck down to the sacrum. And this is due to the fact that the superficial fascia is not totally separated from the deep fascia. 3 minutes, 0.5 ampere with a T plus, and here is the result. Okay, so a detachment, space, okay, space that allow the muscle to glide between each other easily. By the way, the fascia is full of receptors. So this tension can turn into pain easily if the afferent signal gets saturated. If we separate them, we reduce this risk. That's why temperature most of the time is a good idea when I'm dealing with the non-specific low back pain, with non-specific neck pain, with the myofascial syndrome, with muscle tension, tightness, and so on. T plus, the setup is the generator, the plate, the hand pieces, the resistive electrode, hypothermal electrode, hyperthermal electrode in capacity. One of the huge advantage of a T plus is that the capacitive, even in the standard set, can be used without cream. What is the advantage? Not just you're saving some cream, but that you can have a better grip on the skin. You can use the skin as a leverage for the deeper tissue. So we can pull, we can move, we can feel the tissue. Anytime you will apply myofascial techniques or any manipulation, that's the case where a capacitive hyperthermal can be beneficial. Then we have some additional accessories, boosted hypothermal electrode. So an electrode that is able to transfer more energy without increasing the temperature. Comparison between the two, 40 volt ampere without temperature with the normal capacitive hypothermal, 80 volt ampere with no thermal increase with the boosted one. Then resistive lotion free, so that you can have a virtually cream-free treatment with your T+. Diathermic fibrolysis for fibrotic tissue. Fixed pads when you want to combine exercises or when you have you deal with tissue damage and you give a dosimetry treatment, and then the plate heater. Some video example about the application. So you stick the pad on the skin, you define the geometry, and then you use a good exercise to exploit the energy transfer. So the combination of the two is very good. Or diathermic fibrolysis, different sizes for different body areas, from a quadratus lumborum or a scapular area to an epicondylite. Okay, so smaller, the smaller one goes to the epicondylite, the bigger one goes on the back and the quadratus lumborum. With your T plus, if there's a slide that makes sense to remind, is this one. Okay, so I suggest that you take a screenshot of this slide. Why? Because this is the guideline to understand what type of reaction you can stimulate within the tissue based on the amount of power and current flow and the type of electrode. So how to read this? I want to stimulate blood perfusion within hard tissues. I will use resistive between 1 and 300 watt. So a huge range. Why? Because the amount of blood perfusion can vary based on the amount of energy. I want a lot of blood perfusion in less time, closer to 300 watt. I just need some microcirculation with no thermal increase, 1 watt. I need thermal increase within soft tissue, capacitive hyperthermal electrode, okay, 150, 450 volt ampere. Of course, the higher power, the quicker I am, the lower power, I will need more time. I need drainage on along around hard tissues, capacitive hypothermal electrode, okay, and so on. So this is the way to read this. I suggest that you take a picture of this, because every protocol that I will show you is made starting from this slide over here. How we came up with these numbers? The answer is through the scientific studies. Okay, so thanks to the support of the university, we were able to understand how much current flow we need when we need to stimulate thermal reaction, or when we don't want to stimulate thermal reaction. Normally, the threshold is below 0.5 ampere in resistive, no thermal. Above 0.5, thermal reaction. In capacitive, the threshold is 0.3. Okay, so above 0.3 thermal, below no thermal. I hope this is clear, guys, because this is really one of the most important aspects. Okay, some cases, then I prefer to go to the to the protocols. From paratendonitis, edema, one treatment gone. Muscle tear from several centimeters to a few millimeters in 10 days. tendon regeneration. So from a tendon degenerated to a tendon that is starting the healing process. We see here the gray part, the gray fibers substituting the whole. Post-surgery, 21 days. First week, drainage. Second week, drainage and regeneration. Third week, adhesion management with some thermal effect. Okay, 21 day, the girl is back to training. Another example of tendon, once again, the hole over here, the fibers appearance in grayish here, then the tendon appear healed after 8 weeks. Knee replacement. We can treat when we have implants. It's a yellow flag, not a red flag. How? We drop the power by 50% so that we are able to transfer the energy without exaggerating with the thermal effect to acute phase inflammation like a sprained ankle. Okay, so let me get to the other document. Okay, this is the protocol guidelines. We have several, and we have divided it based on the part of the body. Okay, so foot, leg, knee, hip, shoulder, elbow, wrist, column. So these 8, basically. I am sure that not every protocol you might need are stated over here. For instance, unfortunately, we don't have the protocol of the piriformis syndrome, but we could take some examples, like the lumbosciatica probably can give us an idea of the treatment we could perform. So let me, no, maybe if I push on this, let me check 1 second, sorry. No, I need to go myself on on the end. You can buy this asking to Andras, and this will be shared in the pattern that you see. So it's a document that will be shared in a folder so that you can check your protocol anytime, anywhere you need during your daily practice, so that you need to refresh a little bit your mind about the type of treatment required in a specific area. No, okay, so this goes down to the elbow arthrosis. So unfortunately, we don't have the lumbosciatica here, but I will make sure to put down a protocol for you, Laura. So what I will do is, after this session, I will work with our guys to come up with a specific protocol for the piriformis syndrome. Okay, so that we don't leave this question open. Let me get one example for you, like acute patella tendon, so tendinitis. How we read this. So I'd use this session just to give you an idea on how we read the document. So the purposes are to control the inflammation, control pain, reabsorption of hemolymphatic collection, restore local flow, reduce tone of hypertonic muscles, and inhibit local pain receptors. Okay, we need these tools over here, so the different electrodes. Then what we see is every protocol is divided in a maximum of 6 steps. We have, in this case, step 1, modality, resistive, stimuli, vasodilation with O2. Reaction that we are looking for is a lymphatic activation. Position of the patient, supine. Where we put the plate, one of the common questions. Lower back. Size of the electrode, the medium size, the third size. In this case, we could use even the bigger one. Okay, it will depend a little bit on the patient. Targeted point, we work on the lower rectus abdominis, okay, at with a current flow of 0.8 ampere. We need 2 minutes to do that, around 40 watts, and we will move the electrodes holding the handpiece in a slow way. Okay, so light friction and slow motion. I hope this is clear so far. Then, step 2, still resistive with lotion, still blood perfusion. We want to increase the oxygenation of the tissue. Supine lower limb outside the table, 90 degrees. Okay, so this is the way the patient should lay, basically facing up with the lower limb that is able to stay a little bit off the table. Plate still under the lower back, the biggest electrode, okay, the fourth one. Proximal rectus femoral and muscle belly is where we put the electrode. We push with the current flow, in this case, 1.2 ampere for 2 minutes from 40 to 60 watts. We use it in a dynamic way by holding the electrode itself, okay? Transversal friction, peripheral cranial tissue with respect to the foot, okay? So we work there in order to increase the oxygenation of the tissue. We are working on acute patella tendon tendinitis. So what we are doing here, we are stimulating blood perfusion on a proximal tissue compared to where we have the inflammation. So we are preparing the circulatory system to absorb the inflammatory process. Then, step 3, resistive with lotion, perfusion with O2. Still oxygenation. Once again, supine lower limb upside the table, lower back the plate, and we go distal rectus femoris. So from proximal to distal. 0.7 ampere is enough, 3 minutes, 40 watts. Static holding the electrode. Okay, so in this case, we are not moving that much the electrode, but we stay there. So we wait that the flow of charges works for us. But we can combine some light eccentric extension, okay, so that the muscle contraction will call even more blood. Then, step 4, quad vasodilation, modality capacitive hyperthermic without lotion. It means that we want to focus the effect on a specific spot. Vasodilation without O2. This is the proximal vasodilation that will help the inflammatory process to get away from the area, from the targeted area. Reaction, we want to change tissue viscoelasticity and have a vascular response. The neutral plate under the lower back, big flat, no lotion, so we get the biggest electrode and we are not going to use the lotion. Why? This will allow us to focus on the spot without having superficial overheat. 0.4 ampere, so we are in the thermal area. 3 minutes of application, 180 volt ampere, so a decent amount of energy. The more we apply energy here, the less time we need. So if we wanted to drop the time from 3 to 1.5 minutes, we could push to 300. Okay, only in case we are in a rush. Okay, otherwise it's better to stick to the plan. Then some deep transversal massage will help the thermal effect, so some mechanical work in order to create space between the tissues. Then step 5, patellar biostimulation, resistive with lotion, perfusion with O2, oxygenation. The patient is supine with the lower limb outside the table. The plate is under the lower back. We use the small electrode and we go distal with respect to the patella tendon. And the current flow here is minimal, not enough to stimulate temperature. 0.1, 0.3 ampere, 5 minutes, 5 watts. This is a biostimulation, bringing a little bit of oxygen on the tissue, helping with the drainage, helping with the regeneration. Static by holding the handpiece. So we don't want to move around. We don't want to touch the electrode. We don't want to spread the current flow. We want the current flow to go exactly from the surface of the electrode towards the tendon tissues. Finally, and this is normally the final stage of many treatments, especially for acute inflammation, we have the capacitive hypothermic with some lotion. We perform a drainage. So we restore the temperature. So dropping the temperature from an inflamed tissue to physiological temperature. The plate is under the lower back. Once again, we use the hypothermal electrode, the flat one, okay? So the thick electrode that is flat. 0.3 ampere for 10 minutes. So we need some time here. Why? Because the amount of energy is not so big. So we need to wait the metabolic response of the tissue. Maximum 40 volt ampere, maximum. So if it's super inflamed, we go down, so 10 volt ampere. If it's not so inflamed, we can go higher, 40 ampere, volt ampere. Dynamic by holding the electrode. So meaning that we hold the handpiece. So we hold the handpiece and we move slowly from distal to proximal, trying to follow the lymphatic ganglia. Okay, so this would be the process for a lymphatic drainage. So once again, this was the acute patellar tendon tendinitis. As you have seen during the presentation, we have really a huge amount of protocols that we can share. In case you are interested in having this document, you can speak with Andras so that he will explain the process on how to have it. I think I'm back to the, sorry, torno alla riunione. I'm not able to get back to the full screen. Okay, anyway, sorry about that. So, if you have any question, feel free to type it within the chat box. Otherwise, if nothing comes up to your mind and you were a little bit bored by my explanation, don't worry. You can always send a text to Andras by email, and I will make sure that you receive an answer as soon as possible. What I will do for Laura, I have noted down your question about the piriformis syndrome. And just not to escape your question very quickly, normally when you have a piriformis syndrome, it means that we need to deal with different tissues. Of course, the piriformis is one of it. And the main purpose is to create space between the tissues. So work on the viscoelasticity of the tissue. How we do that? A combination with resistive and capacitive, depending on the type of tissue. So if I want to target a piriformis that is very deep and close to hard structure, probably a resistive is my guy. In case I want to affect the thoracolumbar fascia, as we have seen, or a gluteus, as we have seen from the ultrasonography imaging, I would use a capacitive hyperthermal electrode. What would be the purpose? The purpose would be combining thermal increase to change the viscoelasticity of the tissue, combining it with some expansion treatment. So if I am on the thoracolumbar fascia, I can cross my hands with the electrode of my hand on the sacrum first, and then on the diaphragm secondly, and push, create space. Then I would go on the gluteus in order to release in case there's some tension over there. And normally there's tension over there, okay? Increasing the temperature, releasing the tissue, manipulating with my fingers, okay? So I can use my thumb underneath the electrode and push so that I can release the muscle quicker. And then finally, the patient would lay facing up, the plate under the lower back, the electrode exactly on the gluteus insertion, or let's say at the level of the piriformis. And I would ask the patient to perform a piriformis stretching. Okay, so crossing the leg on the knee, on the other knee, okay, and pulling. So pulling up my leg in order to stretch my piriformis, of course, with the patient laying down facing up. Thermal increase, biggest electrode from 1 to 1.5 ampere, thermal effect. When this is achieved, when we feel that the range of the movement is improved by several degrees. So it would be easier for him to perform a stretching. Not to forget, it would be good to work also on the iliopsoas. So when you have some hip dysfunction, it would be always good to work on the iliopsoas in order to release it, especially if you see that the patient has shortening, so some symptotic effect with a short diaphragm, short abdomen muscles, okay? In that case, this would help to create space and release a little bit of tension on the column level. By the way, most of the time when you have tightness on one muscle like the piriformis, it could come also from other muscles contributing to the biomechanics of that area, okay? And it would be as easy as that. If you want, you could close the treatment with some hypothermal electrode on any of the tissue where you have increased a lot the temperature, so where you have accumulated energy. When this is done, when you feel that the temperature of the area is at the same level of the other areas where you have a physiological 36 degrees. Okay, so finally, I was able to get back over here. This is it, guys, for today. We have recorded this session, so as soon as this is downloaded, we will be able to share this with you in case you want that. Make, let's say, the request to Andras, and of course he will convey your request to us. Remind about the questions, so if you have additional questions, feel free to text them to Andras, and he will convey them to us. I see Anna making another question about how does it work with the chronic pain. Chronic pain in general is a huge topic. I don't know if, Anna, this is related to no specific low back pain or in general about chronic pain. Anyway, when you have chronic pain, normally we need to take care of the aspects of the nociception in that case. What I mean, there will be a mechanical origin of pain. Mechanical origin means mechanoreceptor. The example of the thoracolumbar fascia. So if I have a sticky fascia that is not allowing a good movement, I will have pain triggered by the movement itself. What I do? Increase of temperature in order to release this mechanical action, okay? So energy, either resistive is if I'm working on a joint, or capacitive if I'm working on a soft tissue, but enough energy in order to release that tension. Then in chronic pain, it could be such chronic that the tissue is in acidosis, so no oxygen, pH alterated, chemoreceptors are firing a lot. How we can manage that? Blood perfusion and drainage. These are the two wording. Oxygen going there with blood perfusion, drainage to take away the catabolites. Okay, so how we do that? Resistive. This is a work for resistive at the beginning. So from proximal to distal and locally, resistive, big resistive, with a high level of current flow, and then closing with some capacitive hypothermal electrode in order to drop the temperature and support the lymphatic drainage. Then there could be some memory of pain. So the pain has been there for so long that the central nervous system has memorized it. So this pain is difficult to kill with standard physical therapy devices. One of the way to do that is through a V plus. So this is a case where V plus would be super useful in case of pain in order to clean this memory of pain. So a perfect example on how to combine a T plus with a V plus. So, guys, once again, thank you for your time. Let's be in touch soon again, hopefully in presence during one of the courses we are going to give in Slovenia. I think one will be in May, pretty soon. I will be there probably myself in April for some visits, maybe one of your clinics. I hope so. And yeah, that's it. So a big hug to everyone, and see you soon in the next session.